PNC News First is presented by the Bank of Guam, the People's Bank. Pizza Hut, we're taking pizza to where it's never been before. Taco Bell, the only place where you live Moss. Colgate, the #1 brand recommended by dentists. And IT&D.
PNC News First, broadcasting live in high definition from Tumon, Guam, on KEQI and KTGM, and on KPPI on Saipan. Here is your PNC News team.
Half a day you're watching PNC News First. We're live from our broadcast center in Akanta. Thanks for tuning in. Topping our newscast tonight. Several government agencies such as the Department of Public Health and Social Services and the U.S. Centers for Disease Control are working together to spread awareness and control the spread of dengue fever on the island. Let's check in with PNC's Amanda Dedicatoria for more.
After a press release from the Joint Information Center 2 days ago identified a man residing along Swamp Road as the second patient to have contracted dengue fever, Linda DeNorsi, the director of the Department of Public Health and Social Services, says that 2 more potential cases are currently being screened for the disease. During a press conference with several government officials yesterday, DeNorsi says that there was no connection between the first 2 cases and that 18 homes along Swamp Road have been identified to be in the high-risk area, and that the agency is working with the Dedido Mayor's office to eliminate illegal dumping sites, which can act as breeding grounds for mosquitoes. While the initial assessment of the high-risk area in Manilao, the location of the first dengue infection, identified 82 homes within the designated 200-meter radius, DeNorsi says that the number has since increased to 90 due to some of the residents having extended households. Public Health established that the high-risk areas would consist of a 200-meter radius based on the flight distance of the mosquito, which ranges from 150 to 200 meters. In addition, teams dispatched by Public Health to capture and test mosquitoes have found the results to be negative for the disease. To increase early detection rates of potential dengue cases, Governor Lou Leon Guerrero says that Public Health is working on the issue.
I want people to know that Public Health is also sending out trainers to talk to clinicians in the private sector, private clinics, because we want them to also to be able to catch these symptoms and test for it.
In regards to preventative methods such as a vaccine, Dr. Thane Hancock, an epidemiologist from the Centers for Disease Control, says that such a product does exist, but is still being evaluated for whether or not it is a safe option.
The WHO recommendations say that it should be used in places where there's a high level of endemic dengue, so that there's a lot of transmission of dengue, because they find that if you haven't had dengue and you get the vaccine, there can be issues. So that's why the dengue vaccine is not available in Guam, and also would not be helpful for Guam.
While applying insect repellent and wearing long-sleeve clothing is recommended to decrease the risk of infection, DeNorsi encourages the public to remain active in preventing the spread of the disease.
The key here is to do prevention through eliminating all these breeding sites for these mosquitoes, and that is the message we're trying to get out there. And if you feel sick, please see your provider. Informing the providers, please, if their patient is ill and has all the symptoms of dengue, have them tested.
Amanda Dedicatoria, PNC News.
Thank you, Amanda, for that report. Public Health says that the status of the 2 potential dengue cases will be confirmed by today. Keeping with dengue news, we follow a report that mosquito repellent, including sprays, wristbands, and coil, are running low on store shelves. Let's find out what the community has to say.
Guam has declared a state of emergency, authorizing immediate response and procurement of resources relative to preventing any outbreak of mosquito-borne diseases. While the government is working to mitigate the effects of the dengue virus, some residents have raised concerns about the accessibility of insect repellents.
As much as I would like to buy some, there's honestly no way I can because almost every place, major places, have been out of sprays.
My daughter-in-law is stocking up. She uses it on the kids every day. Yeah, we've gone around the house. We've tipped over anything with standing water, and it's a scary situation.
And I'm not freaking out yet. I mean, I heard that there were 2 cases, but I'm hoping and I trust our government to get ahead of it before it gets worse.
I feel for the people that really need some, especially if they live close to the jungle and stuff like that. So I really hope that Guam does get some in stock.
Wholesalers on the island are seemingly sold out of mosquito repellents. It won't be a surprise to the average consumer that once those shelves are restocked, prices will go up. Therefore, laws are set in place to protect consumers from having to pay an arm and a leg for essential commodities during natural disasters. However, a release out of the Attorney General's office states that Guam's price gouging laws cover condition of readiness rather than state of emergencies, which is the case here. According to Speaker Tina Muñoz Barnes, she has received several complaints on price increases for mosquito repellents. In response, the Speaker is seeking to draft new legislation to expand the statute and encompass other threats to Guam so that certain products can be protected.
Many of our most vulnerable in our community lives in homes that don't even have air conditioning, and it just makes them more susceptible to the dengue fever. And I just want to make sure that their lives do not get jeopardized because of a vendor's greed. I think it's really important that as we know that we have those provisions in place for condition of readiness, that we make sure that we include all threats.
As access to insect repellents decrease on the island, some residents who may not want to pay higher prices are seeking alternative methods, such as home remedies and herbal infusions. Residents can get rid of sources of standing water, such as tires or flower pots, to decrease mosquito populations in their area. Reporting for PNC News, I'm Ayana Shed.
In other news, the Guam Memorial Hospital is working to pay off its debt with the Department of Revenue and Taxation to avoid a possible lien that could adversely affect the hospital's finances. In an interview with the Patty Arroyo Show on News Talk K57, GMH Administrator Lillian Perez-Posadas said GMH owes Reventax $8.7 million because the hospital didn't remit employee withholding taxes to the Department of Revenue and Taxation. The previous hospital administration didn't remit the withholding taxes during times when money was tough, and it had to have enough cash to avoid payless paydays. Posada said that they knew about this practice when they took over administration of the hospital, but Posada said they didn't know the severity of the issue until Reventax sent its collection letter this week. Posada said she's not blaming DRT because she knows they're just doing their job. GMH has been trying to collect some $6 million owed by the Department of Corrections to help settle the debt with Reventax. Posadas also said there's no politics involved in the resignation of former hospital CFO Benita Maglona. She said her administration just wants to set a new direction in the management of the hospital's finances. The hospital's assistant CFO, Yuka Hachinova, has temporarily taken over the CFO position. Elsewhere in your news, the electronic monitoring program at the Judiciary of Guam has been implemented for nearly 2 months, and with time running out in how long the program is operational, the court says there has not been any interest. Judiciary of Guam rolled out their electronic monitoring program as a means to keep tabs on pretrial release defendants to ensure the community's safety. But with a slashed budget of $1 million for fiscal year 2020, the contract will be axed once the funding runs out. Judiciary spokesman Sean Gumatautau shares an update on the alternative program.
Where we've already launched, we launched it on August 1st. But yes, the reduction in our budget will have an absolute effect on that program. At this time, there has been no takers as of yet. Again, I know we have already done our briefings with the Defense Bar and the Attorney General's office. We've even posted it on our website, the forms on how to implement it, or how they'll be able to avail of it. But there still hasn't been anyone to come forward, and we know that if anyone does come forward to use the EM program, it will have some help out the Department of Corrections. But obviously for us, it'll improve how we monitor those on pretrial release.
The program is geared toward the indigent, and the client considered for electronic monitoring must fill out an electronic monitoring program packet to be considered for the program. One of the criteria needing to be met is electricity to the home of the client, otherwise the individual may be deemed ineligible. The eligibility packet is available on the Judiciary of Guam website. Sticking with the court, while the administration can't disclose what GovGuam employees will be paying for in regards to health insurance through the newly contracted Aetna International, the Judiciary of Guam shares how their FY 2020 budget is impacted. PNC's Jolene Toves has more.
With a budget already slashed by $1 million, Judiciary of Guam spokesman Sean Gumatauto says they are watching closely to see just how the exclusive contract will affect the court.
We have told the legislature, and it's in public, that we are going to see a $500,000 increase in our total cost. It will put us somewhere around $1.7, $1.8 million in terms of total cost.
While the judiciary believes that this is the most cost-effective program for them, they have put in a lot of effort to ensure that the $500,000 cost combined with the slashed budget does not greatly impact its employees.
But at the end of the day, once the open enrollment is closed, then and only then will we have a real idea what the impacts will be. Obviously, this has everything to do with utilization. For us, anything beyond 77% or the like, which would be kind of consistent with what we've done in the past, it kind of remains to be seen. We just don't know, and we won't know until open enrollment's closed.
Raising the question, how do judicial officers and court personnel feel about the switch?
Most of the employees I've spoken to and the administrator of the courts have spoken to are well pleased with this move. Obviously, there's going to be some that will be in transition in terms of trying to find providers, but overall, they're very satisfied. There's some real huge benefits that are being given to our employees when they select our health care plan. Lower deductible is one that jumps out at us. Right now, with a $500,000 increase, how will that affect our overall operations? We are trying to make every means to make sure that it does not greatly impact our people and the priority that we place on supporting the judicial officers and the staff that support their mission to interpret the laws of Guam.
Gumatauto says the impacts will be great in the next fiscal year, and they are looking at cost-saving measures at this time. He says now they are really going to have to work with their managers to find ways to further reduce their operations, but stresses that it will come at a cost to basic court services. One of the most publicly noticeable cutback already made is the canceling of the employees' parking lot lease and reduction in court services.
I think for us, we're looking at where we can cut right now in what we do. So obviously, our counters are closed right now at 4 o'clock, and intake that might change. We could see maybe a further reduction of hours in those windows. We're looking at also ways that we can reduce in other parts of the operations.
Well, don't go away. When we come back, gas prices go up. We'll have the details. And SMG launches its fall premiere event. Those stories and more after the break.